Aditi Nerurkar for more. Good to have you with us, doctor. So there are these vaccine mandates. How are they going to affect an already stressed healthcare system? And what do patients need to know about the mandate?
You know, Joe, it is so imperative for healthcare workers to be vaccinated. A recent study from the CDC in September showed that 30% of healthcare workers are still unvaccinated. These healthcare workers are interfacing directly with high-risk groups, patients on chemotherapy, with cancer, and those who are immunocompromised. We also in the healthcare industry have to comply with a slew of other vaccine requirements by our employers. The COVID vaccine should be no different.
Dr. Nerurkar, there is a study recently released by the National Institute of Health, and it goes into some of the potential side effects or concerns people had previously voiced as it relates to getting pregnant. And according to this study, they say that the vaccines may temporarily change the menstrual cycle, but they also say that it has very low risk for people looking to get pregnant. However, if a person, male in particular, gets the virus, they say that that appears to slightly lower the chances of conception. Walk us through what this study looked at, what they found, and what does it mean for the rest of us?
So, Allison, this was actually a quite reassuring study. It was 10,000 people in the U.S. and Norway, and they found with the vaccine there are minimal changes to the menstrual cycle. So either a lighter flow, a heavier flow, or a longer cycle, but no different than what some women regularly experience. And so these were reassuring in the scientific community. A related study with the NIH found that there were no links between fertility and the vaccine, which is one of the most common misconceptions and source of misinformation. Another reassuring study.
And Dr. Nerurkar, while we have you, we have a question from a viewer this morning. Harris Hyatt from North Carolina asks, when will the pandemic to endemic really happen? Big picture question there, but what would you say?
Harris, we think about this almost on a daily basis. It is very difficult to predict right now. Lots of modeling going on around this issue. We are currently very much in the acute pandemic stage. We have 800,000 people getting COVID daily, 2,500 deaths. Endemic essentially means that the virus will live amongst us and society will function as normally it would. We currently have a strain or a collapse of many healthcare systems. We are very far from endemicity, but we are very much in the pandemic stage of the virus.
Good explanation to a very common question we're being asked lately. Dr. Aditi Nerurkar, as always, thank you. And if you have a question for one of our doctors, let us know. Email us at morningnewsnow@nbcuni.com. And please let us know if you want to stay anonymous.